Hi, I'm Dr. Gary Arthur in downtown Laguna Beach, here since 1987, and we're going to talk today about shoulders, what causes shoulder pain, and also what you can do, two basic things that you can do to help to improve your shoulder pain, or perhaps help somebody else by referring them to this video. The great thing is when I first got out of chiro school, I had a focus on sports medicine, and I got a chance to work with many Olympic athletes and professional athletes. I've traveled for a couple of years with the Women's Professional Volleyball Association and got a chance to treat two great gold medal volleyball players, as well as pro football players, boxers, world champions. It's been great. But here's a couple things. I want to try to simplify it, because the shoulder is the most complex joint in the body, because basically the only place that the bone actually articulates with the rest of your body is right here at the collarbone. This is a right shoulder. So you have this free floating bone called the scapula right here. These muscles that you see here are the rotator cuff muscles. Their job is to pull the head of the humerus, which is right here, to pull the head of the humerus up in there so it doesn't move around too much. If you get a tear in the rotator cuff like that, then you're going to get a sloppy head of the humerus, and inside here, the little black line that you see, this is called the labrum. This is like a rubber band suction cup that goes around and holds the head of the humerus up into the joint. But it's a very small joint, so most of the capsule around it is the rotator cuff and the labrum. So if I was to specialize in a joint, the shoulder would probably be it, but I also love working with knees and fixing knee problems as well. So let's just quickly talk about what the common problems are. The first one is usually a rotator cuff tear or a strain of a muscle. And that has to be treated in various different ways. An MRI is sometimes necessary to determine how bad the strain or the tear is of the muscle. Grade 1, grade 2, grade 3. Grade 3 is a complete avulsion, which commonly requires surgery, and I have some great orthopedic friends that usually do those surgeries if it's gotten that bad, or if it's dislocated and it's torn the capsule or the labrum or the rotator cuff. Sometimes surgical repair is necessary. But we've had grade 1 and 2 strains and injuries to the shoulder and the rotator cuff that didn't need surgery at all. And so let's talk first about these muscles. The supraspinatus, they're called the sits muscles. That's a way to remember them. Supraspinatus, S. Infraspinatus, I. Teres minor, T. And subscapularis is the S. So in the process, what we want to do is consider if there's an injury. That's one thing that has to be diagnosed and figure out how to treat it. Number two is if you've got pain on certain movements, it means it's usually stretching out a certain compartment or a certain muscle. Let's go quickly in and talk about what actually powers these muscles and gives the electricity for the muscles to be strong and to work well. So we all know, science has proven that the brain is a generator of electricity. And it generates that electricity and sends it down through the spinal cord, and which then goes to all the muscles of the shoulder. So they come down from here, down through a little hole at the base of the skull. They come down through the vertebra, in between the vertebra, into the shoulder muscles. So here's all the muscles of the shoulder we already talked about. Sometimes people get numbness or tingling or weakness in the shoulder. That's because there can be an impingement of the nerve supply going there, so the electrical life force or the hose that goes to the garden has a kink in it, and it's not getting the juice that it needs to be healthy and well. So sometimes with doctors of chiropractic and other progressive physical therapists, they'll see if there's an area where there's an impingement, because if we can remove the impingement and get that life force, that electricity to flow again, then they're going to heal a lot quicker. Okay? So that's one thing. Second thing has to do with the posture of the neck. So if you think about these curves of the spine, that's what helps the water to flow through them. But if you have a distortion of your posture because you had an earlier whiplash and your neck healed too far forward like mine did when I was 26, what that does is it's like taking a garden hose and stretching the garden hose. And what happens to the middle diameter of a garden hose when you stretch it? it gets smaller, right? What's going to happen to the flow of the electricity or the water to the muscles? It's going to get impinged like a kink in the hose. That's why working with the neck to help that energy get to the muscles to help them heal is so important. Now let's just go back into the other room real quick, and I'll show you some of the exercises that you can do on your own. Number one is just a basic posterior compartment shoulder stretch. Bring your arm up here and pull it towards your body like this, and just breathe. About 10 breaths. Then you can also, check me out over here for a second, you can lean into a doorway and stretch out the anterior compartment like this, and just breathe again and stretch out the pec muscle, the pec minor, the pec major, the pec sternal, clavicular division. Stretch it out that way. And then this is one of the best things ever. I was taught this by Peter Goskew, who's a functional anatomist. This is a shoulder warm-up. You should do this before you ever hit a volleyball, before you throw a volleyball, before you shoot baskets, before you lift weights. So the routine is to warm up the rotator cuff. So the idea is your knuckles are like this, and you're going to do forward arm circles. I usually keep the knees a little bit bent. Forward arm circles. I usually have you do at least 30 of these with the thumbs forward. Then put the thumbs backwards and do backwards arm circles. Do 30 of these. And then do elbow curls where your knuckles are resting on your temples. Keep this straight, and you just roll it forward and touch like that. Now, if you have any pain along the way, let's say you get to here and it starts to hurt, then you have to drop down where there's no pain. So if you have pain, you have to go to a lower angle to get it so it doesn't hurt, and you're going to start your rehabilitative exercises. I do always 100, 100, 100 of them when I'm warming up to get ready to work out with weights or to play volleyball or what have you. So those couple of exercises, the forward circles, backward circles, and the elbow curls, if it hurts when you go all the way there, then just go to here. Do it in the pain-free zone. So use those warm-ups, shoulder stretch here, and then make sure that the life force going from your neck and your brain is getting to the muscles. That's how we fix so many shoulders. The other thing we usually do, we'll use some nutrition like blueberries and some other products called Cyruta Plus and Ligaplex and things like that to strengthen up the integrity of your connective tissue and soft tissue around the shoulder. And that's how we fixed thousands and thousands of shoulder problems over the last 32 years. All right, wish you the best. If you want to call 497-2553. That's 949 area code. If you want a complimentary consultation, not an exam, you just want to meet one of the doctors, you can do that. If you know that you would like to be evaluated to understand more about what's going on with your shoulder and how to fix it, then you can set up a new patient encounter, and we'd love to see you. All right, thank you.